Good evening, and welcome to this special edition of Cronkite News on Arizona PBS. I'm Nick Shesky. Thank you for joining us. Tonight, we take a look back at the stories from our health team, from how COVID-19 has affected rural communities in the state to how Amazon is taking a step to provide health care for their millions of employees.
One of the country's hot spots for COVID is right here in Arizona. Yuma County and the city of Yuma itself have a unique set of challenges. That comes from being a rural area on the border. Tyler Mannion went to Yuma and tells us how the county has been devastated by COVID-19.
Yuma is a city full of people passing through. From the farm workers to the snowbirds, the transient nature of its population is perfect for a virus that likes to hitchhike.
I'm going to stop COVID-19. COVID-19 is not going to touch these families in South County. And then suddenly it's just enormous all over Yuma County, right? We couldn't stop it.
Amanda Aguirre manages a COVID-19 testing site that conducts about 80% of Yuma's tests. She knows the population here, which includes 40,000 plus migrant workers who only live here for a few months, makes catching a racing virus difficult.
But now we want to vaccinate them. And they have a very limited time here in Yuma.
Another high-risk population? The seniors that fill area RV parks like Country Roads RV Village.
We've had 75 cases reported either to the board or to our management. We know that there are probably more.
All this in an area with an infrastructure made for a much smaller community.
About 200,000 people live here, and that's not even including the workers that make Yuma the winter lettuce growing capital of the world. But the medical needs of all those people are served at just one hospital.
So if you're in a bigger city and if your ICU is full and your ED is full, you go on what's called diversion. So in other words, you close your ED or you close your admissions and you send patients to other hospitals.
But that's not an option in Yuma.
Sometimes you were holding ICU patients in the emergency department for days looking for beds, or the volume was such that you were transferring out.
Some patients didn't make it out. Father Emilio Chapa leads the parish of St. Francis of Assisi.
Last month of January has been a month that I've never seen this many funerals before.
The county has hope in the form of a vaccine.
The problem is that we don't have vaccines.
Why do you think that is?
They haven't been allocated to Yuma County.
Aguirre believes the systems she has in place for testing could also be used for mass vaccinations, if they had the supply.
We've been told that we've been allocated 400. So what you can do with 400 vaccines, right?
She thinks they could vaccinate up to 2,000 people per day, but last week, her sites didn't receive a single dose. Just another hit to a community that refuses to give up.
You'll see signs throughout the city, hashtag Yuma Strong, and I believe that message is being followed through as far as that we're strong for each other and we're there for each other.
Even if it isn't, all year round. Tyler Mannion, Cronkite News.
The governor directed the state health department to take back doses from providers that aren't administering them fast enough, hoping to get those vaccines to State Farm Stadium and other sites. But as reporter Faith Abercrombie reports, there are other issues causing delays.
That's right, we do have a number you can call that may help you find that appointment. Be ready to write that down after we take a look at the factors that are making it difficult to schedule that vaccination.
Just keep trying. You know, we always know that there's going to be increased demand right away.
About 500,000 COVID-19 vaccinations have been distributed across Arizona, but some vaccine recipients are having trouble scheduling their second dose.
I left voicemails on a few of them because I figured, well, I might as well leave a voicemail, see if someone eventually calls me back. That was a few days ago and I haven't gotten anything in response. So then I've just been waiting on hold. I waited on hold this morning for about 90 minutes and no one answered.
Miriam received the Pfizer vaccine at State Farm Stadium on January 17th. He has even taken his questions and concerns to Twitter. Many other Arizonans across the state seem to have the same problem.
I was like, all right, well, I'll try to go find the second dose elsewhere. But then those sites that I either called or tried to sign up online said you had to have received your first dose there.
When Miriam went to schedule his second vaccine appointment at the location he received his first vaccination at, It showed it was fully booked with no available appointments. With so many people getting vaccinated at once, the need for syringes and needles rise, causing a holdup.
So the Pfizer vaccine comes with multiple doses in one bottle. You dilute it out and you've got X number of doses. Their finding is that you can stretch that out to give more doses. So you can add doses by thinning it out a little bit with the amount of fluid you give or the amount of fluid you actually inject. Well, you need more needles and syringes to do that.
A needle shortage, not only in the state, but across the country, can affect the timeliness of how quick Miriam and many others will receive their second dose.
I think my concern is less about my experience and more about, if I'm someone who's motivated, what about the people who aren't?
COVID-19 vaccination sites across the state continue to fill up, leaving a large portion of the at-risk population struggling to secure doses. Reporter Abigail Verwick spoke with a local doctor about what he's doing to reach those people.
A Chandler doctor's office is determined to reach a population that can be easily overlooked.
To get vaccines into the hands of primary care physicians, which is not where they were focusing. They were focusing on this large pod arrangement.
Dr. Andrew Carroll says one reason he pushed so hard to become a vaccination site was because he knows many of his patients either do not have a computer or the knowledge to complete the online registration process.
I think it's really important. It should be a model throughout our state to get vaccine into the hands of primary care physicians, because that's where patients really want to get their shots.
After struggling to get vaccinated at one of Arizona's larger distribution sites, Donald Mateo and his wife received a call from their primary care physician office.
There was a feeling of anxiety that maybe we're running into this barrier that we couldn't get through.
He's relieved now that he and his wife no longer feel left behind.
It was a great relief. It was like terrific. Hey, and it was like once that happened, it was like grease lightning. You get this thing, and boom, we're right there.
The Arizona Department of Health Services says more than 600 providers have been approved and are eligible to receive the vaccine for distribution once more doses become available. In the studio, Abigail Verwick, Cronkite News.
New tonight, 70 Airbnb listings across the state of Arizona were suspended yesterday for violating the company's policy on partying during a global pandemic. Cronkite News reporter Caitlin Keenahan talked with company officials on how they're enforcing the policy.
This isn't the first time Airbnb has cracked down on the party atmosphere. In August, the company introduced a global ban on parties to prevent the spread of COVID-19. However, one of the main issues they're facing now is the presence of unauthorized parties, where the host is not aware of the events happening inside the home. To combat the issue, Airbnb will now limit reservations to no more than 16 people. According to Airbnb, party houses have been banned since 2019. However, over the course of the last few months, the company identified several hosts in Arizona advertising their home as a party place.
It's just something we're not going to tolerate at this time. If any hosts out there are saying, my home, via Airbnb is a great place to come throw a party right now, it's just not. So we definitely want to send a message to all of our hosts, including the majority who are great people who already understand this, just how seriously we're taking this, and that everyone needs to be doing their part to protect health and safety.
Airbnb officials also say the majority of 70 homes suspended in Arizona will remain suspended indefinitely, even after the pandemic is in the rearview mirror. This is due to repetitive disregard for company policy. Airbnb outlined a few other precautionary measures they're taking to curb parties in rental homes. For example, if you're under the age of 25, you will no longer be able to book a home in the area where you live. Airbnb also wants to point out that there's a 24/7-hour hotline on their website where neighbors to Airbnb homes can call to report parties or events that are disruptive. In the broadcast center, Caitlin Keenahan, Cronkite News.
It's been nearly a year since anyone has really experienced a live concert due to COVID-19. Independent venues are struggling more than most industries, and there's no way around it. These venues are not making money and possibly won't see any sort of income for another 10 to 12 months. Cronkite News reporter Reed Harmon has more on the empty stages.
There is no better atmosphere than attending an intimate show at an independent venue. In Tucson, for example, there's the Rialto Theater, a staple in the city.
It's just, grungy enough to be cool.
without being grungy, if that makes any sense. And it's just a treasure.
Right now, that Tucson treasure is not showing its grunge side to any fans. The Rialto hosts more than 400 concerts per year, but has been unable to set up the stage since the pandemic started. Instead, its only focus to save the stage, something that a national organization is helping with.
All of us banding together around one message and one very clear and simple message, and utilizing all the tools we had. And one is that we're in every single city. There's music venues in every single city in America. And so when we started our grassroots outreach to, lobbying congressmen and senators, they may not know a bunch about our industry, but they know the venues that are important to them and their district.
NIVA, or the National Independent Venues Association, helped pass the Save Our Stages Act, a government-run program that provides a $15 billion grant that helps hundreds of independent venues.
It's supposed to not only get us from the start of the pandemic to here, but really get us to the other side. This is to give the financial stability for venues to come back.
When those intimate venues are filled with rowdy fans again, that's when we all know that the thrill of live music is finally back. We've seen drive-in concerts and streaming performances, but according to Chilton, those are, quote, festival-style productions with a club-style audience, end quote. He said the revenue of those events are equivalent to 1 to 2 shows per year. In Phoenix, Reed Harmon, Cronkite News.
Amazon is one of the few companies that has grown during the COVID pandemic, with workers considered essential to meet the increased demand for online goods. But the company has also faced criticism around its care of its employees.
Cronkite News reporter Mackenzie Allen Charnley has more on the steps the company has taken in Arizona to improve access to healthcare workers during the pandemic and beyond.
Amazon is partnering with Crossover Health to open health clinics near some of its fulfillment centers. The goal is to provide more accessible health care for employees and their families. Amazon is opening 20 clinics like this in Arizona and 4 other states in an effort to provide better health care for employees, closer to where they work. The pilot project just happened to be in the works before the pandemic hit.
This wasn't a reaction to COVID-19, but it certainly was a fortunate silver lining that we were standing by with a healthcare solution and with virtual care solutions embedded.
The 3 Phoenix clinics are in cities home to over 50,000 Amazon employees and their families.
We looked at zip codes for where people lived. And so we were very strategic about saying, okay, well, Maryville is a great example. That is a very strong concentration of where our employees live.
With locations in Tolleson, Maryville, and Tempe, the online shopping giant is trying to bring more effective health care right to the doorstep of its workers. The centers offer everything from primary care to physical therapy at extended hours to help workers who get off after other doctors' offices have closed.
I'm able to get off work at, say, when I get off work at 7 o'clock, they're still open and I can still have that appointment. I don't have to wait until another day to see a primary physician.
Crossover Health says its goal is to focus not just on physical health, but on other aspects of wellness.
I think a lot of people think it's purely clinical, your annual physical, your flu shot, things like that, but also some of the community resources that are really important to this Amazon population. We have a strong care navigation team that goes into regions and researches what kind of resources are available to some of the clients as far as, housing support, financial support, food, shelter, things like that not everyone thinks about when they think about primary care, but all of that, for us, is a part of wellness.
Amazon has faced criticism in the past over the care and safety of its employees. In October, it reported that over 19,000 employees in the U.S. had tested positive for COVID-19. And last year, warehouse workers staged a nationwide protest saying the company had failed to do enough to protect them against the virus. Amazon officials say they are invested in helping support their workers through the pandemic and hope the centers serve as just one way to help improve well-being.
This is really just taking it to that next level and saying, giving someone benefits is now it's being packaged with giving someone the convenient ability to use those benefits.
In addition to Arizona, clinics are opening in Texas, Kentucky, Michigan, and California. But if the project is successful, Amazon says it will look to opening more clinics in other places. In the broadcast center, Mackenzie Amacharmley, Cronkite News.
Tobacco use is currently the leading cause of preventable death and disease in the state of Arizona, and advocates say we aren't doing enough to change that, as Jake Holter reports from our Washington bureau.
Two new reports about tobacco have Arizona coming up short in many areas, and one of the key areas is the state's failure to keep teens away from flavored e-cigarettes.
These are tobacco use rates we haven't seen in decades.
And John Schachter, the Senior Director of Advocacy Communications at the Campaign for Tobacco-Free Kids, says it's the flavored e-cigarettes that are driving this rise in tobacco use. He would like to see a ban on all flavored tobacco products, noting that there are currently over 15,000 flavors of e-cigarettes on the market. Joanna Strother said the least the state could do is make flavored vapes less attractive, the Senior Director of Advocacy for the American Lung Association. She notes that cigarette smokers in Arizona pay $2 a pack in taxes, a tax e-cig users don't pay.
When we increase the tobacco tax, adults, do quit. Some adults quit, and it does prevent youth from starting.
The American Lung Association report gave Arizona failing grades in areas such as tobacco prevention and cessation funding, flavored tobacco products, and tobacco taxes. Strother calls a tobacco tax a win-win-win.
The first win is it's widely supported by voters. And two is that it creates new revenue for the state, which is really important right now because of COVID-19 impact on the state's budget that it's having. This would create new revenue for the state. And then the public health win.
She thinks the lack of a tax is a major factor in what Schachter calls a vaping epidemic in high schools across the state and the nation. Currently, 1 in 5 high schoolers use tobacco products, according to new data from the CDC. Those are numbers that Schachter says would have been unprecedented only a few years ago.
We've brought down rates across the country to record lows in so many states and made incredible progress. I joke we were on the verge of putting ourselves at the Campaign for Tobacco-Free Kids out of business. But then e-cigarettes come along, and all of a sudden we're not quite back at square one, but in some ways we're behind the 8 ball again.
In Washington, Jake Holter, Cronkite News.
That's it for this special edition of Cronkite News Tonight. Thank you for joining us. Stay tuned for Break It Down next.